Today we are going to have second session of our last talk, that was a critical study of yoga technique with special reference to clinical application. It's clinical application part 2, and we are doing it in the process of conducting Indian knowledge system lecture series on occasion of Diamond Jubilee celebration of our Department of Sanskrit, Mumbai University. So at an outset, let me thanks Dr. Shakuntala ma'am and the colleagues from the department for giving me opportunity to be in front of you and share my views. So basically, I am Ayurveda consultant. I am MD in Ayurveda, PhD in philosophy, majors in yoga, and then many other things I have conducted. Apart from yoga, I have done in many other disciplines as well. So coming down to today's topic, in the last lecture, what we have tried to deal with, that what exactly is yoga and yoga therapy, and whether yoga therapy exists first of all, or whether it is just an outshoot. So that was discussed last time, and then we have also seen that if at all yoga therapy was there, then where we can find out the reference about yoga therapy in various classical texts. And then we discussed that in particularly Hatha Yoga, we could see a good number of references, direct or indirect, with reference to therapy part. And then we focused a little bit more on asana practice, and we dealt with some of the asanas. Today, we are intending to do in other aspect, that is, say for example, Om chanting. Now we say that usually we should do Om chanting in the beginning and at the end of yoga therapy or normal yoga teaching session. And then we say it's pious and everything we are aware of. But then if we see categorically with reference to clinical application, with reference to its therapeutic efficacy, then why one should chant Om and how it is going to be useful. Now, in this, if we see that studies are prevailing, studies are there, which are suggesting, which are telling us that by chanting this Om, you get secretion of beta endorphins within your brain, right? And these beta endorphins are the hormones which are also termed as good hormone, feel good hormone, right? And they are actually opposing the effect of your cortisol, which is a stress hormone. So when you chant Om 3 times or sometimes more than that, then you create a level of your brain in such a way that whatever you are going to learn, first of all, you calm down, you are in peace, you are in poise, and then whatever instructions your therapist would give you, you will be able to receive it in a right way. So that is one of the scientific validation of why one should do Omkar chanting. There are studies available on those who don't want to chant Om, but then the effect is similar to humming. So Om, that makar which gets elongated, that also gives similar effect of humming. And that is humming is you can see in Brahmari. So sometimes you see effect of Brahmari and effect of humming, chanting. They are also similar in stress relaxation and things like that. Now coming down to pranayam, because we have dealt a bit on asana, though there could be lot many things to be spoken on asana also, but let us go ahead with pranayam. And pranayam is nothing but a yogic breathing practice. And what kind of pranayam prerequisites that we will see today. So they have mentioned that you can't jump directly for pranayam. Why I'm saying that? Because nowadays you see people asking those who are coming for learning yoga or for therapy, they say, no, no, sir, we don't want to do this yama niyama and all. We just want pranayam and we just want meditation. So we need to tell them that you require to go step by step, and you prepare yourself for actually getting into that particular mode to learn that particular mode. So even Giranda Samhita has very specifically mentioned that Adau Sthanam Tatha Kalam Mitaharam Tatha Param Nadi Shuddhi Tatha Paschat Pranayamam Cha Sadhayet. So they have very categorically said that when pranayam has to be started, when one should start learning pranayam, so one should look at sthana, then kala, when it is to be done, and then mitahara tatha aparam. So mitahar is considered to be very, very important in this. And then once this is done, then nadi shuddhi tata paschat. So nadi shuddhi can be done with the help of your shat kriya or shat karma, and then one can start doing actually pranayam, right? So mitaharam vinayastu yogarambam samacharet nana rogo bhavet tasya kinchit yogana siddhyati. So if someone done start doing pranayam without following the regime of what it has been mentioned at mita ahara, that is mitahara. So if a person, if a sadhak starts doing pranayam without mitahar, then he will get contracted with lot of different kinds of diseases, nana rogo bhavitasya, and then forget about getting any yoga, kinchit yogana siddhyati, forget of getting that final position of getting samadhi, or further away with you know kaivalya prapti, or whatever other aspects they have mentioned now in hata pradipika and giranda samhita. They are speaking about raja yoga also, right? So that may not be that, rather it will not be possible. Now, coming down to the definition part, the definition as it has been mentioned by Patanjali Yoga Sutra, everyone is aware of that. Tasmin sati shwasa prashwasayor gati vichcheda pranayama. So you basically modulate your breathing pattern, right? And that leads to what is nothing but pranayam. Now there is very another interesting and very famous shlok or sutra which has been made famous by one of our stalwart in yoga. I'm sure all of you will recollect what whom I'm referring to. And he many a times used to say in his camps and his discourse that pranayamena yuktena sarvaroga kshayo bhavet. And then the second line, usually I never heard that some anybody is speaking about it. But we should also understand that like how the earlier shlok, that is Nana Rogo Bhavetasya Kinchit Yogana Siddhyati by Giranda Samitakar. Something similar here also they have mentioned Ayukta Abhyasa Yogena Sarva Roga Samudbhavaha. So if you do pranayam in a proper way, appropriate way, then sarva roga kshayo bhavet. All the diseases will get depleted, or all the diseases will get cured or destroyed. Okay, but if it is done wrongly, then all different kind of diseases can get generated. So that is also important. Now, when we read such kind of sutra, then it will be very appropriate to go back to the roots. And we require to learn, we require to see what Tikakar are saying, commentators are speaking about it. And if we see Swami Brahmadatta Tika, Jyotsna Tika by Swami Brahmadatta ji, so Brahmananda ji. So in that he has mentioned that yukta yuktayo pranayamu phalam aha pranayamena iti. So pranayam has to be done yukta yukti purvaka. So what is yukti purvaka? So aharadi yukti purvaka, jalandharadi bandha yukti vishishta pranayamo yukta iti uchyate. Now aharadi yukti purvaka means it is to be done when person is doing vitar. Now, what is this mitar? We will see in next few slides. But then that is one criteria that if a person is about to start pranayam, he has to follow this mitar. Then he has to put bandha. Because nowadays I know many times, many schools within India, within Mumbai, they are teaching that we are not teaching pranayam, we are teaching pranayam like exercise. Because it is difficult to put bandhas. But in certain institute, like where I have learned, say Kaivalya Dham or Yoga Vidya Niketan, where we say very categorically that no, you have to put bandhas. And you know that there are three bandhas, Jalandhar bandha, Uddiyan and Mula bandha. So with those bandha, in a very specific way, in a very classical way, one has to put, and then you should do pranayam. Now, why it is to be done particularly that way? Because when you put Jalandhar bandha, Uddiyan and Mula bandha, then it is getting locked. There is no possibility of air, that vayu, which is going to get escape either from upper level or from down level, right? And in then that case, whatever we are doing, that may gives rise to maximum benefit, and that's how it is to be done. Aharadi yukti purvaka jalandhara bandhadi jalandharadi bandha yukti vishishta. So this is also important. Okay. Tena sarva rogakshaya sarvesham roganam kshayo nasha bhavati. So already we saw that. Now ayukta ukta yukti rahita yaha abhyasat ayuktena pranayamena sarva roga samudbhava. Already we have discussed that if it is not been done correctly, then it can create generation of different diseases if it is ayukta, right? So without bandha and without following aharadi sankalpana of mitahara and things like that. And if it is also not been done by prayer cleansing with Shadkriya, that is also there, right? Then the ratio which has been mentioned by Hatapradipika is 1 is to 4 is to 2. So Puraka has to be 1, then Kumbhaka has to be 4, and Rechaka has to be 2. So Puraka means inhalation, then holding of breath, and again exhalation. That is Puraka and Rechaka, and holding is Kumbhaka. Now within Kumbhaka, you have got Antar Kumbhaka and Bahir Kumbhaka. So either way, they have mentioned holding part is 4 part. So if you take 1, 2, 3, 4 inhalation, then 16 part you have to hold, and 1, 2, 3, 4, 5, 6, 7, 8 you have to exhale slowly, right? Now, if you do play with this, forget about those sadhakas which are learning. In a learning phase, we start with 1 is to 1 without Kumbhaka. So that is fine because you are in a learning phase. But when you try to achieve the last level of doing pranayam, then I remember I had opportunity to sit next to our Guruji, that is Nimbalkar sir, as well as I had, occasion when I learned it from O.P. Tiwari Guruji from Kaivalyadam. And both of these stalwarts, I remember they were saying that you require to be very, very careful and you require to be very patient while learning pranayam. Okay, because it is playing with Vat. And even in Ayurveda, it has been mentioned that whenever you are trying to tackle Vat, Vat has to be tackled like your Jamai, right? Jamata. Jamatavat anupalayat. Jamat means Jamai, right? So if you do forceful activity, then that Jamai will get annoyed and then it can create havocs. So here also, when you are trying to do anything with Vayu, it has to be done very slowly, Shanai, and with Yukti Purvaka. And this particular ratio has to be followed very strictly, right? Why? Because our sir, Nimbalkar sir, has told one story. He has mentioned in one of his, article as well, that his Guruji, that is our Swami Kolanandaji, right? Uh, he has uh, seen one patient who was becoming like kind of insane, and he was not able to understand what people are saying. He was not following instructions. He was in a different zone itself, right? And modern psychiatrists, they have termed himself or diagnosed himself as a psychosis, right? And then when he actually asked the history, then it came out to be that he went in Himalayas for achieving some siddhis, and there he learned pranayama, and then he was practicing by his own. And sir said, means Swamiji said, that probably he might have practiced pranayam in a wrong ratio, and that can also create problems. So one must remember that though pranayam is a very interesting and important tool as a therapeutic tool also, apart from its spiritual and other aspect, but it is like a sword. It can actually save you and it can harm you. It can cut you as well. So we require to remember this. Now, another important aspect about pranayama I need to say here, and then we'll go ahead, that many times people, they think, oh, pranayam is what? Oh, it's easy. Pranayam will increase oxygen all the time. No, it's not. Usually, yes, because when we hold pranayam, when we do antar kumbhak, then you give time so that the oxygen which is inhaled right, will get chance to mix with that oxyhemoglobin complex in the blood, and then the circulation, the exchange of gases will take place at the level of your alveoli, right? That is okay. But whenever you are doing bahirkumbhaka, when you are holding breath outside, then your CO2 increases within your system. And then there is a lowering down of the level of oxygen at that moment of time, to which we call medically hypoxia. And friends, hypoxia is also a very important situation where it can help in certain disease conditions. So probably these stages, they have planned this pranayam in a different way. And some of the time it is hypoxic situation arises. Some of the time you see hyperventilation, like in Brasrika, it is hyperventilation. In Kapalbhati, sometimes it is hyperventilation, and immediately stoppage of strokes in Kapalbhati. Though Kapalbhati is not pranayam, it is kriya. But in some of the texts, they also term it, or some stalwarts in yoga nowadays also, they call it as a type of pranayam. But then in these particularly two processes, afterwards people, they seizes breath, and for some period you don't breathe in, and again that can create a situation of hypoxia for a very minor moment. But particularly Bahirkumbhaka, definitely you see. So either or you can get the result. So not always because of increase of oxygen and increase in hemoglobin. And no, that is possible most of the time. But sometimes even lowering down of oxygen is also achieved. Then secondly, we should also remember that now you and me, we are sitting at Mumbai and very close to seashore, and then doing this pranayam, right? But sages, those time, they used to sit at the peak of the mountain where otherwise oxygen happens to be very, very low. So again, there the physiology differs. Now, I'm not getting into that kind of aspect, but kindly think about these things very specifically. Now, they have also mentioned what kind of complications can be occurring with the help of, not with the help, but by doing wrong practice of pranayam. And in that, it has been mentioned again in Atta Pradipika that hikka shwasascha kasascha shira karna akshivedana bhavanti vividha roga pavanasya prakopata. So hikka means hiccups. Shwasa means breathlessness, to which we call bronchial asthma, right? Kasa is a bronchitis. Shira, karna, akshi vedana. So shira vedana, karna vedana, akshi vedana. So pain, headaches, then earache, and pain in the eye. This can happen because of wrong practice of pranayam. And not just this, but they are also mentioning that bhavanti vividha roga pavanasya prakopata. So it can also create different kind of diseases created by, vitiated increased vata vayu, or vata or vayu, like, vata dosha. Now, in Ayurveda, they have mentioned that there are 80 types of diseases which are created by Nanatmaja Vyadhi of Vata, Vayu. So all those can be also kind of possibility of getting due to wrong practice of pranayam. So friends, be careful. Don't just follow pranayam looking at TV, looking at video. You require to go next to your teacher, sit next to them, and then follow. That teacher or therapist will guide you and correct you if you're doing little wrong way. So you require to do that way. Okay. So what are the prerequisites? So already we have mentioned mitahar, then shuddhi kriya. Rather empty stomach, you should not do with full stomach pranayam. Okay, after immediately having food, you should not do pranayam, you should not do asana practices. So with that of pranayam as well. And bowel cleansing, which is very important. Now, bowel cleansing has never been mentioned in any of the scripts, right? But one of the session, or one of the workshop which I have attended at Kaivalya Dham, and where Tiwari Guruji, OP Tiwari sir, has very categorically mentioned that, look, when we are going to go for pranayam, people, they are getting up early in the morning, just not even taking bath, and just sitting and start doing pranayam. So when your bowels are not clear, then the lower portion, that is bowels, are full in the large intestine, and then the movement of apan is getting obstructed, because the prana is in the upper zone, then apan in is the lower zone, and it has to be anuloman. Anuloman means going towards downside, but here it is getting obstructed, and it becomes pratilomit, that is in a opposite direction, and that can create problem. And that has been very clearly mentioned in Ayurveda, that adho atasya rodena hridayasyoparodhanam. That is what, if you see that a person is not having proper bowels, then your apan cannot go down, and it will go up in a viloma gati, pratiloma gati, and it can push your heart and surrounding regions, and then you feel, oh, as if there is a chest pain or there is a heart pain, and person may get frightened, as if he thinks that there is going to be heart problem. So bowel has to be cleansed. These are one of the things. Then why pranayam is important? Because uh, you cannot control your mind, basically. You cannot catch your mind, but what you can do is you can control mind by controlling your breath, right? So chale vate chale chittam nischale nischlam bhavet, yogi sthanutvam apnoti tata vayu nirodhet. So they have mentioned that you can control your mind, chitta, by controlling your breath, and by doing that, what you gain, one part is to controlling chitta, that is very true. But apart from that, they have said, yogi sthanutvam apnoti. Now, what is this sthanutvam apnoti? So, prayojanam anudishyanam and api pravartate iti mahad ukte prayojane abhave प्रवृत्तिरभावात् प्राणायाम प्रयोजनम आह चले वाते इति वाते चले सति चित्तम चलम भवेत् निश्चले वाते निश्चलम भवेत् चित्तम इति अत्र अपि संबोध्यते. So this is first line is clear, there is no question, but in second line it is very clearly mentioned by Brahmananda ji that vate chitte nischale yogi sthanutvam means what? So sthiratvam dirghajivitvam iti yavat. So sthiratvam and dirghajivitvam apnoti yogi, right? So for achieving that also pranayam has to be understood. Pranayam has to be practiced. Ishatvam apnoti tata tasmad vayum pranam nirodhet kumbhayet. They are mentioning that pranayam is nothing like Purak and Rechak. Pranayam is only kumbhak, because by controlling that prana, holding that prana within your body, you create a sthiti whereby you can have sthiratvam and dirgha jivitvam. And that is what is longevity can be increased, okay, or stability can be increased. So that is what is mentioned by this. Now, Shatkarma Labh. In Shatkarma, what do you do? Shatkarma Nirgata Staulya Kapha Dosha Baladika. So it removes Kapha Dosha and Pitta Dosha and Staulya. That is Meda. Pranayam Tata Kuryat Anayasena Siddhyati. If you do this Shatkarma, then pranayam can be achieved very easily, because the nadis are open. So you can do it. Now, mitaram vinayastu yogarambam, already we saw that. So, what is mitaram? So, shuddham sumaduram snigdham udarardha vivarjitam bhujyate surasam pritya mitaharam iti vidhu. So, shuddham, it should be pure. Then sumaduram, not just madur, sumaduram. Because if it is madura, then it is going to take care of vata dosha, because whenever you are doing pranayam, then your vata is bound to get increased, and so as to balance that, you require to take snigdham as well as sumaduram. So they are opponent of vata dosha guna. Okay. And then udarardha vivarjitam. So udarardha, you should keep it empty, and bhujyate shiva samprityo bhujyate surasa pritya vitaram idam vidu. So basically this aspect we need to remember, because most of the yoga schools, they say, oh, no sugar, no ghee, no fat, they are all toxic. But friends, we have to go back to our original text and try to understand what they are saying, and not just by the means of contemporary people what they are mentioning. Now, coming down to one of the example from Shatkriya, and then we will end our lecture. So there is Danda Dhoti, and everyone is aware what Danda Dhoti is. I am not going to explain that. So Ramba Dandam, Haridra Dandam, Vetrandam, Tathaivacha. So you have got turmeric or banana or bamboo stem, and they are using. Nowadays we are using rubber tube, a flattest tube, right? And they insert it slowly inside your stomach, okay, from mouth inside your stomach. Now, what happens is it gives rise to expulsion of kapha, pitta, and kleda after one conducts proper procedure of Udyan Bandha. So once you put that danda inside particular level, and then you are supposed to, stand with little bending position and do Udyan, create negative pressure in standing position, creating required partial vacuum in the abdominal cavity, and thereby your yoga sadhaka initially do intake water through danda towards stomach cavity, and then cleanses it and takes it out from the in the form of kapha, pitta, and kleda as described earlier. It has been claimed with confidence that by doing this procedure danda dauti, one can destroy or cure heart diseases. Danda Dauti Vidanina Hridrogam Nashe Dhruvam. Now, this is what we study, and we then do the translation and forget. But it has been found that it has been reported that Udyan Bandha is capable of stimulating vagus nerve, and thus gives rise to show a slowing of the heart due to the sinuses, bradycardia, and nodal rhythm, which could produce slow rate arrhythmias of the heart in susceptible individuals, and therefore could be useful as a diagnostic measure to supraventricular arrhythmias. So basically, this is the mechanism of action which we also should able to understand, and then utilize these practices on patient, not just blindly. Okay. Another study conducted on Dandadauti by Gharote and team demonstrated that after performing practice of Dandadauti, free acid was significantly reduced, combined acid was significantly increased, while total acid remaining unchanged in sample of gastric juice at the end of half an hour and 1 hour after Dandaroti. So immediate effect was reduction in all the three acids. So this is again important. That's how that actually explains why Dandadauti is helping us in relieving amla pitta or acidity. Okay, so these are the scientific explanation which we also must know. In yet another study, experimental study conducted by Karambekar and team, it was found that there is a marked increase in the uropepsin excretion after performing Dandadauti and Vastravati. Okay, the identification and measurement of uropepsin, a substance found in the urine, it is thought to be identical with pepsinogen, which is found in the stomach, right? And it has been prompted the idea that uropepsin determination may be a simple and accurate index of gastric secretory activity. So this team, they have tried to collect urine of the sadhaka of the subjects after doing the Dandaroti and before the Dandaroti, and then they tried to evaluate how there is an increase in the uropepsin excretion after doing this particular procedure. Now coming down to final moment, that we as a yoga or yoga therapist shouldn't have reductionist approach of modern medicine, right? Otherwise it will become yogopathy, as I mentioned in my first lecture, that yoga for hypertension, yoga for diabetes, yoga for acidity. It should not be disease oriented, it should be patient oriented, right? So you should look at the entire process with the concept of salutogenesis, right? So you should empower patient, and there should be integration of mind, body, spirit, and universe together. Okay, and the approach has to be then changed from illness to wellness, right? So that is what we need to do. And what do's and don'ts, that do not exceed your personal capacity. Practice should be done in an awareness and rhythmic way. Do not compete with others, but compete with your last performance. Let there be abhyas, that is continuous practice, and vairagya, that is dispassion. You should not get frustrated. Oh, I don't able to achieve the final pose. It's okay. You do at your own pace. Okay. The ultimate goal is to achieve self-realization. That is discriminative knowledge. That is viveka khyati, liberation. That is kaivalya, and not yoga for yoga therapy alone. Though yoga therapy we are using it for different purpose. And with this, I once again say that yoga therapists are not doctors, so they shouldn't say you stop all medication and do whatever we say. We have to work in collaboration with modern medical people, or Ayurvedic physician, or Siddha physician, or homeopathic physician, all Ayush physicians, and you can give yoga therapy as a adjunct treatment. I would like to thank my Guruji, that is Padma Shri Yogacharya Sadashiv Rao Nimbalkar sir, for from Yoga Vidya Niketan, founder of, and all my senior yoga teacher from Yoga Vidya Niketan YVN, yoga section, Department of Philosophy, teachers from there. Then Dr. Shri Krishna sir from Kevale Dham. Then Yogacharya O.P. Tiwari ji, Guruji, and Ganesh Rao sir, Dr. Ganesh Rao sir from Kaivaladham, under whom I had privilege to learn many things. To my mentors, Dr. Ashok Vaidya sir and Dr. Rama Vaidya madam from KHS MRC, where I'm working as deputy director, for giving me vision in the field of yoga and yoga therapy research, apart from Ayurveda and modern medicine. To all my students to whom I taught yoga and yoga therapy at different institutes, to all my patients on whom I use yoga as a therapeutic modality, to all those authors and editors of the journals and texts from whom I have borrowed references for this very presentation, and to my parents and my better half who always encourage me to learn different disciplines, because we believe in Ayurveda that ekam shastram adhyano na vidya chastanishram tasmat bahushrutam shastram vijanya satu chikitsaka. So having multidisciplinary approach will lead to a particular analytical view. So I tried to learn many things. One of them is again yoga. And finally, to the entire August audience who are listening to this particular presentation, and Dr. Shakuntala Madam, Head of the Department of Sanskrit, and Mrs. Dr. Donde Madam, and Mr. Rajesh Bayani Sir from the Department of Sanskrit, Mumbai University, who helped me in happening all this timely and in front of you. So if at all there are any mistakes, those are mine. And if at all something good is there, they're all goes to my Gurujis, all my sir. With that, I hope this might have helped you to some extent. And I really wish you all the best in future, and wish that all of you will be in a great state of health. So sarve sukhina santu, uh, uh, let everybody be in a disease free condition, and sarve santu niramaya. So in that phase, let us use yoga, Ayurveda, and even modern medicine hand in hand, and go ahead with. Dhanyavad. Thank you.